it is my pleasure to introduce Dr. Lisa Goldman, who is an assistant professor of epidemiology and population health of medicine here at Stanford. And she's also one of the leaders of the outreach programs of the Stanford Cancer Institute. And so we look very much forward to hearing about her experiences.
Perfect. All right. Well, thank you so much for having me. It's really a pleasure to be here, and I feel lucky that I got to see the last couple presentations. This is a really wonderful event, and it's so nice that you dedicated your time to this, especially on Juneteenth. Such a nice way to commemorate. So my name is Lisa Goldman Rosas. I'm an epidemiologist by training and an assistant professor here in our Department of Epidemiology and also in the Department of Medicine and Primary Care and Population Health. And here today, I'm in my role as the Associate Director for our Office of Cancer Health Equity and Community Engagement. And so I'm going to talk with you a little bit about how we, as researchers within the Stanford Cancer Institute, can design research that responds to catchment area needs and assets. And why, you might ask, should we be designing research that responds to catchment area needs and assets? Well, I think there's two reasons. One is we're required to, actually, and not many people know that. So as a comprehensive cancer center with funding from the National Cancer Institute, it's an obligation that we have to give back to our catchment area by responding to their needs and leveraging their assets so that we can address the cancer burden in our local area. In addition, it is a way that you can really improve and invigorate your science by engaging with our local community to design research that has impact that you can actually see within your career. So I will move to the next slide. And can people online ask questions? Will I be able to see that? Okay. So please let me know if you have a question as I'm talking, but I'll be happy to answer questions afterwards. So I want to just give you an introduction to the Office of Cancer Health Equity and Community Engagement, give you some background on our catchment area, that is the area that our Cancer Institute serves, and our priority cancers. I'll talk a little bit about how you can design research that's responsive to our catchment area needs, and I say assets because we also like to leverage the strengths within our local community, of which there are many. And then finally, I'll end with a few resources for doing this kind of research. That's going to work better. Okay, so for those of you who are already familiar with the office, I hope you'll stick with me for a minute. I want to share a little bit about who we are and what our goals are. So our goal within the Stanford Cancer Institute is to reduce the overall cancer burden, as well as address cancer disparities or promote cancer health equity in our catchment area. And we add and beyond because we recognize, like one of our previous speakers, that many of us are engaged in communities globally, if not here nationally. So we have four main goals as part of our office. The first one is to monitor the community needs and priorities. And we do this every year within the catchment area. We have a number of databases and data sources that we use to do this. And if you ever have a particular interest in a particular topic within our catchment area, we're very pleased to work with you. We develop and foster and strengthen bi-directional partnerships with community-based organizations and other agencies within our catchment area. We contribute to increasing diversity in clinical trials within the Cancer Institute, and then finally work to translate research findings into practices and policies. So hopefully you will find within some of those objectives that there's one that you resonate with that might be useful for your work. This is who we are. So I'm part of a larger team. Our director is Alyce Adams. She's a professor also in the Department of Epidemiology as well as Health Policy. Myself, and then Lydia Shapira, who is an oncologist, breast oncologist, a professor in oncology, and also leads our cancer survivorship program. So we each have different roles, and you can contact me or you can contact any one of us and we will help you get to the right person if there's a particular interest that you have. We also have a team that is growing, and that team is there to help you to integrate community engagement and catchment area needs into your research. We have connections, personal connections throughout the catchment area with community-based organizations and patient groups. And we also just hired a new program director who will be joining us with experience from another cancer center that she'll be bringing to us to be able to integrate our work. Okay, so I want to talk a little bit about what our catchment area. Can I see a show of hands of people who are already familiar with what our catchment area is, or if, okay, so this is maybe new information about the population that we serve. So we have a 10-county catchment area here in the San Francisco Bay Area. So down south, we call this the Peninsula, or here where we are now, the Peninsula South Bay. So that's Santa Clara, Santa Cruz, and San Mateo counties. So right up all the way to Daly City. And then just south of us, we have the Salinas Valley, which is San Benito County, a very small population, as well as Monterey County, a much larger population. We have the San Joaquin Valley, which is made up of San Joaquin, Stanislaus, and Merced counties. And actually 11% of our patients come from San Joaquin Valley. And if any of you are from there, drive there, spend time there, it is quite far from our central area here in Palo Alto, but indeed 11% of our patients come from that region. And then finally, the East Bay, which is Contra Costa and Alameda counties. So for those of you who are familiar with the Bay Area, you'll know that our patient population in this catchment area is widely diverse, as well as the geographic regions that they encompass. So you can imagine that the San Joaquin Valley, of course, is largely agricultural, and the Salinas Valley is largely agricultural as well. And you know that our Peninsula and East Bay are diverse in terms of race, ethnicity, as well as in terms of the cancer risk factors and cancer burden in those areas. Okay, so in addition to knowing more about our catchment area, it's important to know what our Cancer Institute priority cancers are. So the priority cancers that we focus on here at the Cancer Center are lung, breast, pancreas, liver, and lymphoma. The risk factors that we focus on are low screening, for example, could be cervical cancer, breast cancer, colorectal cancer, lung cancer, tobacco use, obesity and physical inactivity, alcohol use, and we focus on the populations of Black, African American, Latinx, and Asian Pacific Islander with our programs and outreach. So here on the slide, you can take a look at the cancer incidence for our priority cancers in California in the dark blue compared to our catchment area in the light blue. And of course, you can see that we're virtually identical to California as a whole. And if I were to include the US here, you'd actually see that as a state and as a catchment area, in some cases, we tend to have a lower incidence, not all. But then this obscures meaningful differences across racial ethnic groups, potentially across geographic groups as well. They don't have that to show you here today. And the starred incidence that you see for some racial ethnic groups for some cancers indicates that the rate of cancer in that particular group for that particular site is elevated compared to California as a whole, or the dark blue. So for example, you can see that breast cancer among Black and African Americans in our catchment area is higher than that for California as a whole. Similarly for Asian Pacific Islanders. You can see the same for African Americans for pancreas, liver, and lymphoma, and for Asian Pacific Islanders for lymphoma as well. So again, if there's particular data from our catchment area that would be useful to you, say for a grant or for a project that you're working on, we're happy to use the data to help you take a closer look. So this is cancer mortality. Similarly, where the catchment area mortality by cancer type is similar to California, although you do see some elevated mortality rates among specific racial ethnic groups within our catchment area compared to that of California. So let's talk a little bit about our cancer risk factors. So here you can see some of our cancer risk factors in the United States, California, and then we've broken it up by region. The majority of this data comes from the Behavioral Risk Factor Surveillance Survey, which is done now every 2 years. We do get some data from the California Health Interview Survey as well. So you can see the rates of current smoking, obesity, physical inactivity, and binge drinking. And you'll probably notice that in our Salinas Valley and San Joaquin Valley, those regions which are furthest from our center here in Palo Alto have some of the most troubling cancer risk factors that we need to address. And this adds information about colorectal cancer screening, cervical cancer screening, and mammography. So here in California as a whole, we're very similar to the US, but you can see some disparities by region. Okay. So I'll just say one more time, if there's information about the catchment area, either incidence, mortality, or risk factors that we can help you for a specific project, we're really happy to work with you. Okay, so now we're going to talk about what it means to design research that's responsive to our catchment area. Responding to the needs and assets in our catchment area requires community engagement. So I want to talk a little bit about what that means. Community engagement is defined as the collaboration between institutions of higher education, such as ourselves, and their larger community context. So whether that's local, regional, state, national, or global, for the mutually beneficial exchange of knowledge and resources in the context of partnership and reciprocity. So I have a colleague who has given us kind of a framework to think about community engagement in many different aspects of academic medical centers. So sometimes we think about community engagement as it has to do with education, how it has to do with clinical care, can be related to policy and advocacy, or community service and community outreach activities. What I'm talking about today is specifically related to community engagement to facilitate research, and specifically research that addresses health disparities or promotes health equity. So you can see that down there at the bottom. You might have heard many synonyms for community engaged research. We use it as an umbrella term. You might have heard terms like community-based participatory research, patient-centered outcomes research. There's a number of other ones here, translational research. But they essentially all fall under a general term of community engaged research, which can refer to engaging many different types of groups. Now, I've mentioned that this is for the specific goal of health equity. So I wanted to talk a little bit about what I mean by health equity. You might have heard terms like health disparities and health equity used interchangeably. Health disparities are differences between groups that are unjust or unfair. And health equity has to do, I like to think about it, with your glass half full. So what can we do to ensure that all groups have equitable access to their full potential of health? The Robert Wood Johnson Foundation is a wealth of knowledge about how to address health equity. And if you're interested in this topic and maybe just starting out, I would really recommend spending some time on their website. This is a graphic that comes from there that I think really captures what we mean by health equity. So it involves identifying the health disparities. So like our first objective is to monitor the cancer burden in our area, that has to do with identifying what are the health disparities that we need to address. And disparities are not just differences, disparities that arise because of differences in social structures, right? So then health equity has to do with changing and implementing policies, laws, changing environments or practices to address those differences, evaluating and monitoring our efforts over both the short and long term, because we know this takes a long time, and reassessing strategies in lights of processes and outcomes and plans for next steps. So if you just take a look at the graphic, which I think describes it better than words, equality is distinguished from equity by looking at giving everybody the same bike. That would be equality, whereas equity would be giving everybody a bike that fits them best and allows them to move. So I like to make a note just about the the alignment of community engagement and workforce diversity. So this is a diversity conference, and we're really interested in talking about how diversity intersects with our research in many ways. And diversity and inclusion efforts often go hand in hand with efforts to engage our community and address health equity, although they do require very distinct practices and strategies as well as resources. Right? Okay, so I want to make a note that when we talk about community engagement as an umbrella term, who are we really talking about engaging? We're talking about patients, caregivers, could be providers and staff in community health center or community clinics, community-based organizations, other clinics and healthcare systems, policymakers, and other stakeholders that might be relevant for the research that you're doing. This is my colleague, Kent Key. He's described a range of community engagement from maybe no involvement of the community on the left, all the way to completely community driven. You can find yourself across the spectrum. There's no right or wrong answer. We encourage that depending on where you find yourself in the spectrum of engagement, whether it's very little, just getting started with outreaching to the community, or really bi-directional partnerships, thinking about how equity and contextual factors that lead to equity influence the community engaged research that you're doing. So the foundation of any community engaged research is a equitable and bi-directional partnership with whoever you're engaging, whether it's patients or other stakeholders. So the way that you do this with your partner is collaboratively prioritizing topics that you're going to focus on in your research, building upon the strengths that exist within that patient group or that community group as identified by them, making sure they're integrally involved in all phases of the research project. That doesn't mean just a focus group. It can mean engaging with them all the way out to designing your analysis and disseminating the results. Sharing resources from the research with your partner, and sharing a goal to increase research capacity in the partner organization or among the patient group, and a commitment to disseminating findings to the community in an effective way. So there are many benefits of engaging community partners or patients in your work. We like to group them under better science and better answers. It really can improve your science as well as the potential of translating your findings to that next phase of translation. And then it has this side benefit, of course, of increasing community trust in academic and scientific institutions. So we have a number of resources that you can call upon to facilitate your work in community engaged research. So this is our community advisory board for the Stanford Cancer Institute. I welcome you to come to the meetings. I'm very happy for you to come and present your research and get feedback, or to meet with them and identify potential other partners that might be interested in your work. Here are other resources. So as I mentioned, tailored assessments of the catchment area for your particular project or area of expertise. Assistance in identifying partners that might be meaningful for the work that you do. That can be helping you to do a map to figure out who those people might be, or actually identifying partners that we know, or calling upon existing partners to find additional partners. We have a program called Science Cafes, where if you have very early translational work, perhaps, you can present that with community partners in an informal setting where you can share your science and get questions and engage in dialogue with patient groups, oftentimes in support group settings. Again, you can meet with our community advisory board, that's CAB. We can also help you in identifying funding that might support developing partnerships, because there's very little funding for that part, and we know it takes time and resources. And I believe we'll talk about some seed grants here through SCI that you can use for that. We can write parts of grants when they call for engagement plans and you don't know how to do that. We are happy to help you do that. And then soon we will have a group of patients called Cancer Health Equity Ambassadors, similar to the CAB that you can meet with. And I'll end there. Thank you so much for your time.
Thank you so much. This was fantastic. Are there any questions? Yeah, Ted.
Yeah, thank you very much for that presentation. I was curious if you had any thoughts on, to be honest, I don't know the makeup of the audience here, but as somebody who operates primarily in basic research, about how to connect basic research to these kinds of resources, because this is something, you know, I've dealt with various advocacy groups and grant applications and things, and I think largely, you know, listening to them, that was a very positive experience. But you know, their complaint was that as basic researchers, we're only thinking about this when it comes, you know, we're being asked a question on a grant about, you know, okay, how does this affect health disparities or some of these things. And so I feel like, yeah, educationally, there may be opportunities for basic scientists to get involved in this process. I wonder your thoughts on that.
Yeah, I'm so glad you asked that, because we have a lot of wonderful basic scientists in the Cancer Center, and we're really trying to create opportunities to engage with the community. We designed the Science Cafe specifically for that. So we work with you as a researcher on how to design your Science Cafe and talk to patient groups about your topic. Some people don't need training, others do. And then we partner with an organization to do the actual cafe. Unfortunately, we started this during COVID, so it's never been in a cafe, but it's been on Zoom. But we plan to go to other settings eventually. And then we also do the evaluation to kind of understand the impact on the researcher as well as the attendees. And the idea is to foster more discussion kind of outside of the grant application or any sort of particular deadline, so that you can identify people who might be interested in partnering in the future, and you don't end up with your next grant panicking about a community engagement plan. So that's the idea. That's one strategy. If you have other strategies you'd like to try, we'd be happy to hear.
And you might want to connect with Dr. Hyun, who received a seed grant. He's also a basic scientist, and he also just connected with Lisa and her team. So I think that's sort of like along the same road. Yeah.
Thank you.
Yeah, thank you so much. Yeah. I have one other question for imaging scientists who are interested in the seed grants from the Stanford Cancer Institute. Yeah. Can you talk a little bit about what priority areas might be? Of course, there are always a lot of like considerations that come into play, but the Cancer Center does have some areas of priority, right? Yeah, could you speak to that?
Sure. So I mentioned our priority. Well, I'll just step back and say the Stanford Cancer Institute is prioritizing research that involves community engagement or patient engagement, because, like I said, it is a requirement of our Cancer Center grant, as well as a priority of the Cancer Center for giving back to our local area. So I think that seed grants that are submitted with significant plans, meaningful community engagement plans, will be highly favored. I think that seed grants that focus on our priority cancers, which I just presented, are also prioritized by the seed grant funding, and then as well as any sort of screening or risk factor focus. And then I will say ones that address health disparities or seek to promote health equity, even if it's not immediate, but maybe has the potential down the road, would also be favored. And we're moving towards having a community engagement review of every seed grant. That hasn't happened yet, but it is a plan. So I think it's a great time to be thinking about how to do this.